Hello and welcome to another edition of NHIS in a Week. My name is Angela Siedu. Now to our headlines. Central Regional Staff praised management for quality leadership. NHIS management interacts with managers and drivers of the Central Region. And Asim Fosu District Office gets a brand new vehicle. As part of the Central Region working visit by Executive Management of the National Health Insurance Authority, a dinner was organized for managers and drivers of the authority in that region. The spokesperson for the drivers praised the direction of new management in enhancing their welfare.
Doctor, we thank you very much for the very first moment you took your position. You distributed vehicles for the entire country, which Cape Coast Central Region benefited 3 of them. We say thank you so much for giving us the vehicles for our operations. Since you took the seat of your office, to mention a few, there are so many changes that has come on board. Our per diem as drivers has been increased. Whenever we renew our driver's license, you reimburse us. We also say thank you.
And responsibilities of members. We'll also intensify registration exercises at the institutional and community levels. We'll strengthen stakeholder engagement to update them on operational activities and solicit their views for decision making. We'll also enhance periodic monitoring exercises at provider side to ensure policy compliance. Conclusion. It is our fervent hope that you will resolve the enumerated challenges to enhance operational activities and delight our customers. We appeal that you would organize periodic training and capacity building for staff in the Central Region and promote deserving staff who have been loyal to NHIS over the years. Your leadership impact has been felt by all and sundry. During your short stay in office, the region has taken delivery of 5 brand new Toyota Hilux pickups, laptops, desktop, computers and accessories, printers, and free NHIS branded cloth. We are so much proud of you, sir. It is said that many beautiful things cannot be seen or touched. They are felt with the heart. What you have done for us is one of them. And all we can say is thank you and forever thank you.
The CEO was appreciative of the efforts of all staff of the region. He called on the schemes in the region to collaborate with the co-payments committee to reduce the issue of illegal payments charged NHIS members at provider facilities.
The most important, or let me say one of the most important committees that we have in the next 20 years is this co-payment committee. I would like to plead with all the schemes, please, let's take it serious. I'm happy that the regional director has told me you have, I think, a first report. I can't just wait to take a look at the report. We are going to work seriously on this report. We are going to invite hospital directors and ask them questions. We are going to talk to Director General, Ghana Health Service, and we will not be scared of withdrawing the credentialing status of facilities who are engaged in blatant, unapologetic, illegal fee taking. We are not scared of anybody. And I can let you know that the President of the Republic himself asked me direct questions on these illegal payments. So I don't want trouble. If anybody wants to cause trouble for me, I will first cause trouble for that facility.
Central Regional staff took turns to honor the executive management of the authority for the excellent show of leadership. The staff pledged their support to work hard to ensure that the scheme is highly accepted.
As the most feasible and reliable public service organization, may this dedication God on to achieve higher results in public service, politics, and private life.
Thank you.
So we are grateful to.
Now, still on the Central Regional visit, the NHI team paid a working visit to the St. Francis Xavier Hospital in Asimfusu, one of the key stakeholders and providers of the National Health Insurance Scheme. The CEO, Dr. Okoboy, acknowledged the challenges some providers face, but added that the authorities working assiduously to mitigate those challenges, particularly pertaining to claims reimbursement.
That's why when we, as part of our tour, we put Asimfusu NHI office on our plan. I said it's important that we also touch base with providers. You are our key partners. Our objective is to ensure that patients have access to healthcare without the risk of being cut out due to financial reasons. But if we provide the financial reasons or access, but they still don't get what they want from you, then we have not achieved anything. And I know for sure that we depend on you to serve them. You also depend on us to run. And just like any partnership where each party has a role to play, sometimes the parties must talk because you might have one party having some challenges, the other party either is not aware or has a different perception about the problem. So our visit here briefly is to thank you for all the service. For me, I've had a personal experience of what happens here. These are my best. If I'm not well and I have to take it to hospital, I'll tell them bring me to St. Francis.
The administrator of the St. Francis Xavier Hospital commended the NHIS for their continuous efforts in ensuring access to healthcare, especially for the poor and vulnerable.
You're coming very much. The collaboration has been great. In fact, the questions I was going to ask, you have answered them. Yes, you have answered them in a very nice way for me. Because I asked myself, put myself in your shoe, and I said, how will you respond? Because you are limited, so I have to be realistic. Certain things you can't even answer in public, and certain things you have to. So you have answered those questions, which are very critical. I know how, when I meet my doctors, how we are going to also talk so that we can strengthen the relationship going forward.
Moving on, the team who later paid a courtesy call on the MCE of Asin North were received by the presiding officer of the assembly, Mr. Kweku Ado. The Asin North District Office also received a new vehicle to run the operations of the NHIS activities in that catchment area. The NHIS team visited the Ebura Asebu Kwamankese office of the Central Region. The CEO took time to interact with staff and some members who had visited the office to patronize the services of the scheme.
But your head in the idea on here. So on here, my to be on my hospital, going to get it to much all a pipe papa. And so here, and the hospital be so quiet, no so on your head. Only a private. Nay, a man is on watch. It is a nibia on what too much all a pala. Denton had no one into me in your head. Nipping partner a year the mazana. Jabian won't use. Nenam dying the mazinity, a butchers can be a name you been punchia, Jita Cobosia. Nenam there will be ninety on what 2 minutes or board me.
The Winneba and Wager district offices were not left out during the management's 3-day tour of the Central Region. Here are excerpts of the visits.
His little brother is he's my mate in school there.
The Deputy Chief Executive in charge of operations, Mrs. Viviana Lokobia, interacted with LEAP members who are being registered for free under the Integrated Social Services Program.
Hospital. Who the cause, who the insurance in the hospital, we are now hospital. We said, do you and Koba? Insurance, no, so I So I'm going to my money. I just say, Auntie, I didn't see them. So, what is that?
Now to our final story. Members of the National Health Insurance Scheme visiting the South Pond Government Hospital can henceforth walk straight to an NHIS customer service center for rapid response to their needs and concerns about the scheme. Executive management of the NHIA praised the opening of the center.
Operations of the NHIA is also dear to his heart. He always wanted to be a part of its commemoration. Since he took over, he's been around the country. This is perhaps the 9th region that we have come to. And so he had to squeeze in time to stop by here briefly for us to do this ceremony before we carry on. So we just hope that this facility will be of service, most importantly to our members, so that anything that they encounter, even the facilities itself, we have our staff who will be present here, we can have a better exchange and a better service delivery.
Now, this is how we wrap up on this week's edition of NHIS in a Week. For more stories, log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screens. Thanks for watching.